My name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Do you ever wonder who is Dr. Hauser's most complicated case? Well, you're going to meet him today because I'm going to introduce you to him. And this is him. This is the setup that he has in his house. This is Kevin. And you could see where he had such horrible neck problems that caused so many horrible things. And I'll let him tell his story later on in this video, but he set up where his TV was on the ceiling and you could just see his bedroom there. So his story is really, really interesting. But vocal cord paralysis, wow, there's lots of different terms that are used for vocal cord dysfunction, laryngospasm, Munchausen, Stridor, because there's people that will tell people whose voice has gone or whose vocal cords aren't working that it's because of stress, it's because of stress, because of stress. And then whenever I, as a structural doctor, hear that something's from stress, I'm thinking it's vagus nerve degeneration, it's vagus nerve degeneration, it's vagus nerve degeneration. I'm going to just go off the script. When I was first getting trained as a pain doctor and I did my pain rotation, and this is like back in the 90s, the doctors, my professors were telling me people have chronic pain because they're depressed. And I had become a Christian by then, and I just say that in that Christians are trying to get at the truth, or at least live their lives based on the truth. So I was interviewing the people, and I'm just telling you, every one of them was fine, then something changed. Now they're depressed. So let me ask you this. If your voice, all of a sudden you couldn't speak, or you had swallowing difficulties, you have a lot of pain, you feel like you're choking, would you be depressed? Would you be anxious? Of course the tests are going to show you're anxious or depressed. Like, who wouldn't be if you have a chronic ailment? You know, so it's like the people who have vocal cord dysfunction, they are fine, then all of a sudden they can't sing, they can't speak, their voice changes, they're now aspirating their food into their lungs, like something's changed. And the thing that has changed probably is they have some type of injury in their neck structure, which I term cervical dystructure, breakdown of the neck curve, and it's injuring the nerves that go to the muscles that we call the vocal cords. Spasmodic dysphonia. So that's another common term that's used for this. So you see some of the symptoms, like you're starting to see some of the symptoms. Asthma symptoms can come from vocal cord dysfunction, dysphonia, where it's painful to speak. Again, swallowing difficulties, and of course, singing and speaking. Yeah, so vocal cord dysfunction basically is because the vocal cords, the muscles don't abduct the vocal cords so air can get in, especially during inhalation. So you could see where, imagine if the opening, that air goes into your lungs, like that opening got closed and you couldn't open it. Besides just having difficulty speaking, there would be times where you would have like air hunger or be panicky, like you can't get a deep breath. Like I said, it can mimic asthma because all of a sudden you have obstruction of airflow into your lungs. Well, that's basically what asthma is. You know, and then the origin of it was in hysterical women. I'm not negating that stress can't cause this, but again, most of the time when you talk to people, you'll see that probably it isn't from that. Like, it isn't from that. Like, the person had a nice marriage, you know, they were doing well, and then all of a sudden something changed. And the thing that changed is the neck structure. It's known by a lot of different names that I talked about. Occurs primarily in middle age, age 37, 3-to-1 female predominance. You've heard me say this before. Whenever I hear that a condition is way more common in females than males, I don't right away jump to, oh, it's crazy females, right? I jump to the main difference between females and males is females are loose jointed and males are not loose jointed in general. So it's ligamentous. conditions where, Ehlers-Danlos syndrome, conditions where there's a high propensity more in females than males, think ligamentous. So it's ligamentous injury in the neck. Almost all the time, vocal cord dysfunction, when you see it, it's chronic. It is triggered by what? Exercise, respiratory infections, food, singing, laughing, weather changes, scents, airborne irritants, and emotional stressors. You might say, well, why is that? Well, any sort of stressor increases your sympathetic system. And when you have vagus nerve dysfunction, which that's what we're leading to, is that the cause of vocal cord dysfunction is recurrent laryngeal nerve dysfunction. It means that the vagus nerve is having difficulty having the electrical impulses go through. That causes the body to have sympathetic dominance. So in other words, the body already has sympathetic dominance because of the vagus nerve dysfunction. So then when a person on top of that gets an additional stressor, that imbalance between the sympathetic and parasympathetic system just gets bigger. So the treatment isn't, oh, I'm going to give you Xanax or give you sedatives or drink a lot of alcohol to reduce your sympathetic tone. A better option is, why don't we do a lifestyle and a structural program that's going to ultimately improve the vagus nerve impulses getting through, improve vagus nerve function, improve vagus nerve function, improve vagus nerve function. And when you do that, the vocal cord dysfunction starts going away. Let me see. Okay, so this is one of the ways that we document it. So what normally happens is you'll see one vocal cord's working really good, and the other side, you could see this one isn't moving as much as this one. So one of the ways that you determine that somebody has vocal cord dysfunction is an ENT doctor doing a laryngoscope, where they actually take pictures of it. We can do ultrasounds of the vocal cords and see, can it abduct or can it not abduct. And this is basically, this is normal. This is when somebody's going like E, or they're doing some kind of vocalization or phonation. When there's unilateral paralysis, see how this one didn't abduct. This vocal cord didn't abduct. And then bilateral paralysis, normally we don't see that. Normally it's unilateral. But I would preface that by saying the other side normally isn't normal. It's good enough to function where the person wouldn't have symptoms if the other side was as good, because cervical destructure or breakdown of the cervical curve normally affects both sides. But typically people will have more instability on one side than the other, and that instability is affecting the vagus nerve in a negative way more on that side than the other side. So you could see where if the opening for the airway is supposed to be this big, but it's only this big or this big, would you have some air problems, air hunger problems, feel short of breath, feel like you're choking, feel like you have to clear your throat all the time? Then, of course, your singing voice, the power of your voice. So I'll just tell you a little bit about me. So if you ever saw me at church, you'd see me and you'd be like, huh, Doc isn't singing so much after like the first few songs. So like, you know how there's real powerful singers? Like the better your recurrent laryngeal nerves are, the more singing power you're going to have, right? So for me, I can sing a few songs, and might I say I don't sing them very well because I'm monotone. I have disabilities, what can I say? So basically after a few songs, like literally my recurrent laryngeal nerves, man, I just listen and I enjoy other people singing. So if you've noticed that your power of your voice, or you're not able to sing as much, that's going to be most likely a recurrent laryngeal nerve problem. This is basically what an ear, nose, and throat doctor would see when they put a scope in the back of the larynx. See how this one is really open and then this one isn't as open as much. So in other words, the muscle, the vocal folds here, they can't abduct. they can't abduct. And these are the common symptoms with vocal cord dysfunction: loss of vocal pitch, weak cough, noisy breathing, fatigue, shortness of breath, loss of gag reflex. So that's what I see a lot when I check for gag reflex, and of course hoarseness or change in voice. Another thing that it's called is laryngopharyngeal reflux. People get sore throats, hoarseness, sensation of a lump in the throat. That's kind of a common one. If you have a chronic cough and no one's been able to get rid of the chronic cough or show you what it is, it's most likely vocal cord dysfunction. And what we do is we do ultrasound, and then we do motion scanning of the people's neck, and then we measure the vagus nerve. So we measure the actual vagus nerve and see if like one side's smaller than the other, the side where the vocal cord isn't moving so good. I'm going to leave this up just for a little bit. If you're wondering if you have it, if you answer yes to any of these, it's possible and probable that you have vocal cord dysfunction. You know, do you have a sudden onset of attacks? You might say, well, why would I have a sudden onset of attacks? Well, think about it. If the problem is that the impulses from the recurrent laryngeal nerve, and I'll show you where that nerve is, if the impulses aren't going to the muscle that abducts the vocal cord, then of course all of a sudden you can have an acute attack. In acute attack, it's like there's so much salivation, and it's almost like the person is dying or drowning in their own secretions, and like having trouble getting air. I mean, it is scary. Like I had a friend of mine, we were on the golf course when it happened to them. I mean, it can happen. It can happen so acutely. Do you have a restriction in your throat? So in other words, people say like swallowing or something's getting choked right here, doc. It's getting choked right here. It's getting choked right here. Well, what happens is that when you have a breakdown of the neck curve, it actually narrows the airway. The more the upper airway is narrowed, the pharynx, the laryngeal part of the airway, the more that's narrowed, well, you got to realize then the more open the vocal cord opening has to be. You know, and obviously, do asthma medications help? So there's a lot of different medications that people use, and when I hear that a person was prescribed a sedative such as Xanax, Valium, clonazepam, things like that, and it helps, I don't think that, oh, the person is a stressed out person, the person's an anxious person. I just think of that the imbalance between the sympathetic system and the parasympathetic system is there. But the treatment, the better treatment is, what can the person do to strengthen their vagus nerves? These are all the various laryngeal nerves. So the posterior cricoarytenoid muscle, that's the one that abducts the vocal cords. That's innervated by the recurrent laryngeal nerve. So that's normally the culprit. So it's the recurrent laryngeal nerve impulses aren't getting through to the posterior cricoarytenoid muscle, and that's why the vocal folds, the vocal cords are together, the muscles are together, and then the pitch of the voice is changed. There's lack of power in the voice. There's a choking sensation because air can't get through there. And then there's increased secretion. So that's what, you know, and there's times where I have that. And then this just shows this is the left recurrent laryngeal nerve. This is the right recurrent laryngeal nerve. Some of the symptomatologies, because the sensation, the vagus nerve input to the larynx or the pharynx isn't quite there. And this is what I call it. I call it leaky larynx. You've heard of leaky gut. So leaky larynx is that the vagus nerve input to the larynx is inhibited. So then the mucosal cells of the larynx then are leaky. So they're leaky, meaning that when Dr. Hauser inhales ragweed or some kind of pollen, I might inhale them, but my immune system doesn't interact with them. But if I have leaky lung, or I have leaky pharynx, or I have leaky larynx, what's going to happen is I'm going to be hypersensitive, right? Isn't that what allergies and asthma is hypersensitivity? And then people take all these medications. Well, maybe if we just closed up those tight junctions, the tight junctions of the mucosal cells in the larynx, in the bronchial tree, in the lungs, well, maybe when I inhale ragweed or I inhale any sort of other pollen, I won't react to it. Well, basically that's happened to me. You know, I always was terribly sensitive to pollens, especially ragweed. And now, I mean, I go the whole year and it just, it doesn't affect me whatsoever. And I think a lot of it is, you know, from my vagus nerves just being a lot better. Okay, and again, this is more of a frontal view. This, you can see where the left recurrent laryngeal nerve, that's the one that's normally affected because it has a longer course than the right one. And basically the recurrent laryngeal nerve is a branch of the vagus nerve. So when all the things that I say about vagopathy, cervical vagopathy, it applies to this because one of the branches of the vagus nerve is the recurrent laryngeal nerve, and the recurrent laryngeal nerve innervates the muscles of the larynx. So whenever that somebody has some kind of symptom that probably is related to the larynx, change of voice, shortness of breath, a choking sensation that they feel is up here, they can have like, doc, something's always, it feels like something's caught in my throat, you know, chronic coughing, even chronic hiccups, you know, that can be, you know, all of this. And then this just shows, see how the vocal cord, this is on a CT scan, the vocal cord on this side isn't working. It's adducted and not abducted. Cervical instability is not the only cause. Like obviously there's lots and lots of different causes. But by the time somebody comes to the Hauser Neck Center because of vocal cord dysfunction, all these things have been ruled out pretty much. ENT doctors, neurologists, they make sure somebody doesn't have these things going on. But basically, the normal cause of vocal cord dysfunction is a problem with the vagus nerve, the recurrent laryngeal branch. And the treatment of that, in my opinion, is a correction of their neck curve and prolotherapy for stabilizing the cervical vertebrae. There's lots and lots of different triggers for vocal cord dysfunction. We talked about some of them. Any kind of stressor, infection, things that stimulate asthma, that normally makes it worse. If somebody has gastroesophageal reflux, I see a lot of that with people who have vocal cord dysfunction because, again, it stems from a vagus nerve injury. So what are the other vagus nerve symptoms when somebody has vagus nerve dysfunction that they might have? Well, it would be an anxious state, inability to handle stress as good, chronic fatigue, allergies, autoimmune diseases, gastroesophageal reflux because the lower esophageal sphincter isn't closing, nausea, bloating, diarrhea, constipation, digestive tract isn't quite working right. A person could have tachycardia, right? You've heard me say many times the vagus nerve slows the heart rate down. So somebody who has tachycardia or palpitation, that would be another sign that they have an injury of the vagus nerve. So how do we treat vagus nerve problems? Well, obviously I do get involved with lifestyle things. So if somebody has autonomic dysfunction, like the sympathetic system is much stronger than the parasympathetic system, which represents the vagus nerve. So the vagus nerve stimulation makes acetylcholine, which is the hormone for the parasympathetic system, and acetylcholine that slows the heart rate down, slows the body down, helps the body repair, digest, regenerate. So vagus nerve dysfunction affects a lot more things than just the vocal cords. Having a lifestyle where stressors are minimized, trying to take a positive attitude, and it's a lifestyle positive. I'll just share with you one thing. I went to church on Sunday, and our pastor, who's a really good friend of mine, we played golf on Thursday. And after the round, we played a championship course, a stream song. He shot 79, I shot 80. And we're leaving, and he was saying, oh, if I went to hit it here, if I went to hit it there, you know, he hit one out of bounds, then he hit one in the water. And we played a championship course, and we hit so many good shots. And during the sermon, he told the story of him being negative after the round. And I'm like, we hit so many good shots. Like, it was such a hard course. And then when I would hit a good shot, not every shot, but when I would hit a good shot, I'd be like, that was awesome. Like, there's water there, there's out of bounds there, you have to draw it, there's a big trap there. I would be like this, because the bottom line is, we just tend to be emotional about all the negative. Like, we got to start being emotional about the positive. And we all know that you can rewire your brain. So if you're somebody who has any of this stuff, and you know you tend to be negative, or you go to the negative, or you let people bother you, like, why can't you go to a meeting, even if it's going to be a rough meeting, and say, this meeting's going to be awesome. It's going to be great. And you just go there with an unbelievable smile. You'll probably see that people will catch that positive vibe, and things are going to be a lot better. So a lifestyle of positivity, lifestyle of peacefulness, lifestyle of joy, lifestyle of love, then treating the structural thing. So the structural thing relates to, I think people should get a lateral neck x-ray. Because once you see the problem, you can do something about it. If you don't see the problem, you think you don't have it when you really have it. So somebody has a broken neck structure, the first thing is make sure your workstation's high. If you're watching TV, make sure you're looking up at the TV screen. Like you saw Kevin there, he made sure the TV, he literally had it on his ceiling. I'm not saying you got to get it on your ceiling. But the point is, if you never during the day use your neck muscles, all that's going to happen is your head gets more and more and more like this. And the only neck curves that I've seen here that start out decent are when somebody is a dancer, or they're doing some kind of athletic, or they're under an upper cervical chiropractic care, under that where they're under the care of somebody who knows about the neck curve. Otherwise, everybody else, their neck curve is just terrible. So in our office, we do cervical curve correction. That's to get rid of the cervical destructure part of the recurrent laryngeal nerve injury. Then if they have instability, so if you have clicking, popping, grinding of your neck, you have tension that never goes away in your neck. Like it doesn't matter how many massages you get or how many adjustments you get, the tension is still there. It's probable that the muscles are trying to prevent destructive bone movement in your neck. And why do they need to do that? Because the destructive bone movement is hurting your vagus nerve. And your vagus nerves are the most important nerves in your body. Like you just saw that you can't have your vocal folds close off because that's how air gets into your lungs. So that's why the muscles are just clamping down, clamping down. So the way to resolve the instability is a treatment called prolotherapy. And then if I feel like there's muscles or something that are compressing the vagus nerve or the recurrent laryngeal nerve, we can do nerve dissection, which is called hydrodissection, where between the fascial plane, and you can see this with ultrasound, where we stick a needle between the fascial planes of the muscles where the nerve is. When you put the fluid in there, it just separates. And often we use PRP because PRP has cells and factors in it that can help nerve regeneration, and sometimes we'll use that with the prolotherapy. So my encouragement to you is you absolutely can resolve it. Even if it's gone on for a long period of time, it normally can be helped with correcting the neck structure, and if instability is present, do prolotherapy to tighten the ligaments, muscles relax, easier to get your neck curve better. Not only is the vagus nerve function improved, but believe it or not, also brain function normally improves too, because the vagus nerve runs with the internal jugular veins, which is the main veins that drain the brain. They run in the same sheath called the carotid sheath. So once that sheath is opened, all the structures within that sheath, the internal jugular veins, the vagus nerve, spinal accessory nerve, glossopharyngeal nerve, and those nerves involve swallowing. They're involved with neck tension. They're involved with blood pressure, heart rate. So many, many things are improved with this type of a program. Anybody who's known me for a long period of time knows that I'm getting gray hair and I'm losing my hair. And if you ever wonder why that is, man, taking care of Kevin Hartle, ooh, gosh. Like if you ever wonder, like, God, what are the cases that are hard for Dr. Hauser to get better? It's Kevin Hartle. So I have no idea where this video is going to go, but I appreciate you being here, because you and I both know it's very, very complicated. Your case is very, very complicated. But I thought we should have you on because, you know, one of the presidential candidates is Robert Kennedy Jr. Like, we know Robert Kennedy Jr. And anybody who watches videos of his, like, say 5 years ago or 10 years ago, he didn't have the raspy voice, right? He didn't have the raspy voice. And everybody knows, like, geez, why is it his voice? Yeah. So when your voice goes like that, and obviously, Kevin, you'll tell your story or what's recently happened to you, but that's called vocal cord dysfunction. So vocal cord dysfunction is when the muscles that open and close the vocal cords that are in the larynx, when the nerve supply to those are hampered or injured, and you know, the muscles of the vocal cords are innervated by the vagus nerve. And anybody following these videos that I do know that a lot of what we do at the Hauser Neck Center is help people restore their vagal nerve function. So if the nerve supply to the vocal cords isn't good, then of course you can't produce sound normally, because sound is produced by air going over your vocal cords or your vocal folds. So Kevin, you know, again, you know, like Kevin, you need a styloidectomy, you know, and man, does he give me detailed information like the blood supply and all kinds of things. So you probably know more about cranial cervical junction problems than I do, you know, because you study it. But why don't you let's just first start about the vocal cord thing. Because, you know, your voice was good 6 months ago or 4 months ago. So tell me what's going on. And then.
Well, since 2020, I've had periods where I would go hoarse. They were always just brief, and mostly when I was laying down and talking on the phone for a long time. But this happened. I was starting to feel better, so I was not wearing my collar as much. And I took a late morning nap, and I was sleeping on my right side and woke up pretty instantly from an overstretch on my right side. And this was after having the styloidectomy on my right side. I don't think that really had a lot to do with it, but maybe it did. So I overstretched. I didn't really want to get up because I'd come out of a deep sleep, so I had gone back down and started to go sleep again, and then I just stretched it even more. And then instantly started having spasms through my torso, down both legs and in my arms, and just kind of whole body tremor kind of stuff. So I, you know, got up in a panic, and from then on, my voice and difficulty speaking just got worse and worse and worse over like the next week. And by the end of a week, I started having really difficulty swallowing and started aspirating. And at that point, I called my doctor. This was midnight on July 3rd. And he's like, call 911 and go to the ER at that point. So I was in the hospital for observation for about 5 days. And then they sent me to Encompass for a rehabilitation hospital. At that point, I couldn't walk upstairs. I really couldn't walk. I was in a wheelchair. and couldn't talk, obviously much worse than this, and was aspirating every time I tried to swallow. So, you know, with physical therapy, occupational therapy, speech therapy, over the last month now, it's been getting better and better. I can swallow, you know, I have to swallow with intention and have to be very conscious about it when I swallow, but I don't aspirate most of the time anymore.
Can you swallow liquids, or it has to still be thick? Because you know when you have
Yeah.
aspiration, meaning that you drink or eat something and part of it goes into the lungs. That's what aspiration is. So normally, you know, because I'm a rehabilitation doctor, physical medicine rehab, so I had a lot of training way back when in the 90s on with speech pathology and barium swallows and.
Yeah.
So a lot of times, you know, they put you on like thick, you know, only thick liquids, not thin liquids.
Yeah, they kind of recommended that, and they also recommended the mixed fluids.
Are you okay now? Can you drink water and it not aspirate? Or are you still?
Yeah, I can, but it's, you know, sometimes it's the chin tuck to the right, and that's most of the time when I eat food, I've got to swallow kind of like that. But often thin liquids, it's more of a chin tuck to the left, or I'll do like a, you know, kind of a compound motion. It kind of depends, I think, what muscles are in spasm and which ones are releasing. It's somewhat different, a lot.
So when you're in the hospital, you're getting a lot of opinions. There's doctors seeing you. Did they come to any conclusions as to what was causing all these things, like the leg things, the swallowing things, the voice?
There's a lot of, they seem to, like, you say I know a lot. I've learned so much from you and all of your videos. That's really where so much of it's come from, and then I build on that. Because I can't read very well because my eyes are so bad. So mostly what I learned from is his videos and through YouTube and through you and whatnot. But it's so much of it's just vagus nerve and cranial cervical instability. You know, because like your foramen magnum is like grand central station of your whole body nervous system. So the more I injure that, which I keep re-injuring it because, you know, it's cranial fixation is the surgery that I would need to really stabilize everything. I'm really trying to avoid that surgery at all costs because I've had so many other fusions at this point.
How many prolos of your neck total? Like I know you saw other people beside me initially. So including those, like how many prolotherapies would you say you had, and how many have I done on your neck?
Well, I did the pickle procedure with Centeno Schultz. But I had a styloid at the time. So that would tighten everything up, but just bring my styloid further into my carotid sheath. So I think that's why that didn't work. But the styloid was never diagnosed until I came here.
So I right away sent you for that, right?
Well, we did some prolotherapy and curve correction to see if I could avoid another surgery. But, you know, after just 2 prolotherapy sessions, I could actually do like a jumping jack again. I was starting to progress. But then it was clear I needed the styloidectomy because I started declining again. And it was clear that it was the styloid at that point. But then, you know, I was trying to avoid a travel all the way across the country to Los Angeles to have Dr. Harshborn remove it. So I tried with a couple surgeons here in Florida. Nobody else believed that the styloid could be causing all of this. So it took me basically almost a year till I could finally, and I ended up having to go to California to have Dr. Harshborn remove it.
So when was that? When was that you had that?
That was in February.
Oh, so that was this year.
February this year,
Okay, so then obviously then there's a time period where you're recovering.
And it was May when I came back and started prolotherapy again.
And then prior to May, how many prolotherapies had I done?
We had done 6. And we finished May.
Do you have a sense?
Last year. We finished May of last year.
Well, let's just talk about that. Like the 6 prolos that you got, do you feel like it was stabilizing you or not?
So much,
Like you were starting to get back, but the styloid was.
I could do
so we tried. Okay, so then. So then you get this. Did the styloidectomy help or it didn't help?
Yeah, it helped tremendously.
Okay, so what kind of things, just for viewers who aren't familiar with a styloidectomy?
My styloid was really occluding my carotid artery, my jugular vein, as well as, stabbing into, it was very pointy, so it was stabbing into the vagus nerve, the hypoglossal nerve, the glossopharyngeal nerve, and the spinal accessory nerve. And so, what really kind of happened for me is, I think the spinal accessory nerve was causing so many of the spasms up the right, particularly the right side of my neck.
Okay.
And that's what, back in 2016, then gave me thoracic outlet syndrome. So I've had, both of my ribs removed for that. And then that didn't really fix it. So then we went ahead and did the spinal fusions, C3 to C7.
That was all before I saw you.
All before I came here, exactly. So it was, the only, back in Houston, Texas, it was basically just surgeries.
Okay.
And I had surgery after surgery, and that wasn't really getting me better.
I know, but let's just talk about what symptoms from the styloidectomy, by opening up the carotid sheath there, what
occlusions stopped.
I know, but what symptoms? Not medical things, like what symptoms? Did your brain clear? Did you get less dizziness? So explain symptoms, what symptoms got better?
I had, not having the occlusions, my brain fog went away like instantly. Like I could think clearly.
Okay.
I was starting to be able to solve, problems like I built a computer. I've never been able to build a computer.
Good.
And I could do all the research that I needed to do to learn how to build a computer. So I built my first computer after. I've been trying to set up my own home studio so I can tell my story also. And so I've done all of that, which I was never able to do. I couldn't figure all the pieces out. So, I'd say mental clarity is probably the biggest thing that came back.
So if I would have interviewed you in the early summer, like speech was fine, mental clarity.
Was fine. Yeah.
Mental clarity.
Mental clarity was coming back, but it was really like after the next prolotherapy session, because after the surgery, my cranial cervical instability actually got a little bit worse.
Okay.
So nausea was a big problem after.
Okay.
So I was still taking on Danzatron.
Okay.
But by the time I did the prolotherapy, I was off of all my medications.
Okay.
And I was really getting better.
Okay.
But then it was this sleeping injury.
So this is the first time I'm seeing you since you were hospitalized and So just so everybody knows, so it's like, but we've been in communication, and then, so, we did some tests, then we're going to go over the tests tomorrow. Obviously, your speech is affected, so what did the doctors tell you was wrong? Like, what did they say was wrong? Or they just don't know? Or did they say, they don't know?
No.
We just really appreciate you sharing your story. Anything else you feel like the audience should know about you, or?
I don't know. Prolotherapy works. I wish I'd found this, back when I was 20 years old.
Well, before you had all the fusions. Because, it does make it, people don't realize when, and I'm not, I'll send somebody for a fusion, like there are emergencies and everything. The problem is if you get a fusion and you're already a little bit loose jointed, now when you turn your head, you only have like 3 segments or 4 segments instead of 7 or 8 segments moving. So all the motion has to go in 3 or 4 segments instead of 8 segments.
Yeah.
So then, of course, that gets loose. So that leads to its own.
Yeah, I don't know, because, all of this came primarily from an injury. I had a sailboat mast fall in my head. And so I had compression injury. They thought I had football. And I was a football player when I first came in because I have football neck. Okay. So I had bone spurs and arthritis anyway, so I don't know that I could have avoided all of that.
Okay.
But, I started having dizzy spells when I was 20 years old.
Yeah.
So if I'd, found you at that point and done prolotherapy, maybe I'd have a very different outcome.
I got you.
But either way, prolotherapy, I've always wanted to tell my story of how much prolotherapy has helped me. But I do keep re-injuring myself, so it's been kind of a hard story to tell. But it's just because everything else that's going on with me. But it always makes me feel better. Like I'm having prolotherapy again on Monday because I know it's going to tighten things up again. And, the next surgery for me would be a cranial cervical fixation, which, just more fusion is not ultimately going to make me better. My only hope to get out of this is going to be the prolotherapy to tighten things up. And then I'll try to just not re-injure myself again. So it's all about, wearing the collar and being careful.
Yeah. Well, eventually, obviously, to get you out of the collar.
But always being careful. When I sleep,
Okay.
sleep in a collar. Because, that's sleeping is when I do my worst injuries.
If anybody here, I would just say to the audience and to you, Kevin, is we still don't have the answer, and maybe you could help, or somebody in the audience. Like, we haven't come up with something that's comfortable enough during sleep, but doesn't block the jugular veins and can keep the neck in good alignment. So if you want to, because you love inventing and different things.
Right.
So I just asked somebody if somebody can come up with something, because people need that, because that's a sad story, what you just said. Like you weren't quite done with your prolotherapy, like you weren't quite done. And then, geez, you had, like, people don't realize when you have upper cervical instability at any point in time, like that's, the bones are moved. I just call it bones are moving in destructive ways.
Yeah.
And it's like what you said, the vital structures are all here. Like, there's a reason God put, the carotid sheath here, because your eyes can protect this area. Like, it's right underneath here.
Yeah.
So when you have instability, it means it's exactly right. Like, I've had other people where they're doing really, really good.
Yeah.
Then, because it's 8 hours, you're in some cockamamie position. So, so you're a classic example of, like, we got to come up with something.
Well, part of my problem, too, is from the injury, I have a structural scoliosis. So my head, very straight, is actually kind of turned to the left and chin up a little bit. That's where my bones want me to be. But, God made me perfect. So he wanted my muscles, want me to be back straight.
Right.
So it's always this fight. My body's kind of fighting between where my bones want me to be and where my fascia and my muscles want me to be.
So I think you're taking something really bad that you could just have given up. Like, there's many times you could have given up. So you're you're an inspiration, because you just, like, what do I next need to do? And you kept plugging along. And even though you've had these, you're doing good, then this happens, and you're doing good, and that happens, you're still like, I'm going to use my disability to help others, like, just to help others. So
I think gratitude is probably one of the biggest things. And I fought gratitude early on. I hated when people would say that.
Okay.
It's like, I'm not grateful for anything. This is terrible. But then, often I would see other people doing videos with you, or meet other people in Facebook support groups and whatnot. It's like, wow, they actually have it a lot worse than I do. And then so I started, like, okay, I am grateful for, what I still am able to do.
Yes, sir.
And focus on your abilities and more than your disability. And once you let yourself go and love and operate out of love, that's the biggest thing. Because you can get caught in anger and hatred pretty quickly and pretty
like what
easily.
you don't have and what other people have. And
exactly. And then, and even the people, that say, because there's surgeries that I've had that, have been a mistake and had to be redone, or there's surgeries that I shouldn't have had done because they didn't solve anything. And so, I can get angry about that. But then, there's the same surgeon has done something good for me that did solve a lot of problems.
Okay, good.
And I'm grateful for, the medical industry, as flawed as it is. I'm still grateful for the things that we do have, because without it, I would be dead now. I wouldn't have had my styloid removed. I wouldn't have had the bone spurs removed.
That's a good way.
That really were causing other problems. So, as flawed as we're all flawed.
Yeah.
So accepting that and accepting your own flaws, and often what you get angry about is what you see in other people, but you actually have.
That's a good way to put it.
Once you recognize that, and you recognize that your anger can be actually driven by facing your own insufficiencies, your own issues, can be enlightening, and then you learn to laugh at it and love it. It's hard.
Okay, so I'm going to see you soon. Like, we'll restart the prolotherapy, and then why don't we just be optimistic that we'll make another video like when you have your voice back.
Yeah, I hope so. Yeah.
But thank you again for sharing your story.
Thank you for having me. Yeah, thank you for being here. Thank you for existing. Because you really did save my life.
Thank you so much.
Yeah.